Welcome back to Living with Back Pain. This is episode 3, the last 9 years of back pain. In episode 2, I encouraged you to share your experience with injuring your back. So the question I want to answer is, why now? What has the last 9 years been like, and why have I decided now to do something about it when I've had this back injury for so long? My initial injury, I thought, was like any other injury. I thought ibuprofen, some ice, and it will heal. Like a knee injury or a shoulder injury, I was treating it the same way. I kind of failed to recognize what was really going on. I thought I could heal from it and move on. I also failed to realize what motions or movements caused me to re-injure my back. For example, one day, I leaned forward and I attempted to write on a piece of paper that was sitting on a desk. And as I was leaning forward at the waist, I collapsed. It was excruciating pain, and I had re-injured my back. And I had to have some friends drive me home, and I was laid up in bed for a couple of days. I was still trying to live my life normally. I was still lifting, albeit with more leg and less back, but I was still working in the yard, and inevitably I would overdo it and I would hurt myself and I'd be laid up in bed for a couple of days. And I come to the conclusion that I was just another person with a bad back. And how many times have you heard someone say, "Oh, I have a bad back," or "You must have a bad back"? And I treated myself like everyone else does and thought that I was dealing with it. But I wasn't. It was getting worse. I failed to learn what triggers that and how to avoid it. So I was having, at first, 1 or 2 re-injuries per year, and then it became 2 or 3, and then 3 or 4, 5 or 6 re-injuries per year. And I just couldn't continue. On my best days, I was avoiding doing things that I would otherwise normally be doing: bending, lifting, leaning. On my bad days, I was in bed on muscle relaxers. But on my worst days, when I re-injured my back, my vertebrae would actually move out of alignment where I could feel that my back was out. My hips were not level. I would go to walk and one leg would swing and miss the ground because my hips weren't level, and I would be in terrible pain. And the nerve pain at that time was quite bad as well. I was unable to look upward. That was also impossible when my back was out. Early on, those worst days were cured with a visit to the chiropractor. I would shuffle in, I'd be hunched over, and walk out of there standing upright. How many of you that have had back pain before have walked into shuffled into the chiropractor's office, hobbled in there, and been able to walk out? It is a really good feeling to be able to do that. But twice I left their office only to put my back out, getting in the car or driving home and getting out of the car. I'm quite tall, over 6.5 feet tall, and getting in and out of the car, I have to kind of bend over and hunch sometimes. And twice I put my back out. And to be completely honest, that was infuriating, and it was devastating to go through that. Having been through the pain, get the appointment, go in, feel the relief, and then have to go back and deal with it all over again. So the second time, I just drove home, and I was in bed for 3 or 4 days, and I rolled over in bed one day, and my back popped, and it was back in. And so I'd failed to diagnose and properly treat myself, so I went back about my normal life. I finally learned what causes most of my back pain. And it's anything where I lean forward at the hips, like brushing my teeth in the sink, washing my face in the sink, doing dishes. Anything where unsupported, my weight leans forward. Now, I'm not a doctor, and this is not medical advice, but I finally learned from my own experience, about 2 years ago, my back went out, and I was able to put it back in place. And I've used this numerous times. This is not advice for you, but I laid on my back, face up, and I took my left leg and I lifted it up and I crossed it over my right leg and pointed it straight to my right. And then I took my right shoulder off the ground and twisted to the left. So I'm kind of, lower body is twisting to the right, upper body is twisting to the left. And I would swing my leg quite hard, and I would feel my back pop and go back into place. And I'm able to roll over on my stomach and get up on my hands and knees and then eventually stand up. And that saved me several times, and I haven't had to go to the chiropractor for a couple of years. But just like you, I've been to the doctor, a chiropractor, physical therapist, and I've done therapy at home. I've taken tons of muscle relaxers, ibuprofen, Tylenol. I've missed work. I've been laid up in bed. And as I mentioned in episode 2, if you haven't watched that, please do. I've missed too much of my life. And maybe you've experienced the same thing. Let me know in the comments. So a few months ago, I made an appointment with my family doctor again. And I recounted my injury and all the things I've done over the last 9 years with the pain and the treatment. And my doctor ordered an MRI. And I have an episode about my experience with an MRI, and it's going to be coming out soon, so please check that out. But here's a picture of my MRI result inserted here, so you can see my L5-S1 joint. As you can see in the image there, that lowest disc is quite collapsed, and they diagnosed me with moderate to severe spinal canal stenosis and a collapsed L5-S1 disc. So I saw that imaging, and I had two different results, two different emotions that came out of me. And the first part, I felt some relief, some acknowledgement of the pain I was having, that it and all these self-imposed restrictions that I've been doing, that it had a purpose, it had a reason, that it was real, and it wasn't imaginary, and I just didn't have a bad back. And the second one was I realized the gravity of the situation with how bad that disc is, that its repair was beyond physical therapy or learning to lift properly. So if possible, it may even require back surgery, which is not an attractive option. But looking at the scan, it's clear that this is serious. So have you had an MRI? Have you had your back looked at with some sort of imaging? What was your result? Share in the comments there. So my family doctor sent the MRI to a local pain doctor for a consultation, and I'll share that experience also in a future video. So please watch for the MRI experience. I've got a story to tell, and my reaction video to that. It'll be coming out next. I hope you like that. Thank you for watching. Share your experience with how long you've lived with back pain, and if you're beginning to take action, what caused you to do that? And I'll see you in a future episode. Thanks for watching.